Infection Control in Healthcare, Part 1. Blood-borne pathogens are organisms that cause blood-borne disease and may be transmitted by blood or other body fluids from an infected individual to other people. The two most common blood-borne diseases are hepatitis B and HIV. Other diseases include hepatitis C, syphilis, and malaria. Universal Precautions states that blood and body fluids from all patients must be treated as though potentially infectious. It was introduced by the Centers for Disease Control in 1983. It's mandated under OSHA's blood-borne pathogen standard. The hepatitis B virus is a virus that causes an infection of the liver. Symptoms of HBV are fatigue, low-grade fever, stomach pain, diarrhea, dark-colored urine, anorexia or weight loss, aching muscles or joints, nausea, jaundice, and light-colored stool. Fluids to which standard applies: blood, semen, pericardial fluid, which is around the heart, peritoneal fluid in the stomach, vaginal secretions, amniotic fluid around the abdomen, cerebrospinal fluid in the brain and spine, synovial fluid in joints and legs, pleural fluid around the lungs, other body fluids, unfixed tissue, and contaminated organs. If you cannot differentiate between body fluid types, consider it potentially infectious. HIV is a retrovirus that destroys the body's immune system. Symptoms are unexplained persistent fatigue, chills, diarrhea, anorexia, leukoplakia, unexplained fever, night sweats or shaking, unexplained weight loss over 10 pounds, lymphedema, and persistent dry cough. Modes of transmission of blood-borne pathogens: vaginal, oral, and anal intercourse, sharing needles, contaminated blood products, sharing personal care items such as razors and toothbrushes, tattoos, ear piercings, acupuncture with infected needle or equipment, neonatal infection during birth, skin, eye, mucous membrane, parenteral contact, breast milk of HIV-infected mother. Tasks that may involve exposure: wound care and debridement, personal care of the patient, patient transfer, exercises, positioning, suctioning, catheter changes, enemas, impaction removal, IM sub-Q injections, vascular access procedures, respiratory treatments, CPR, douches, insertion of vaginal or rectal suppositories, oral or rectal temperature, whirlpool, emergency first aid procedures, transporting or processing laboratory specimens, dental procedures, surgical procedures, and post-mortem or morgue care. Hand washing is an essential work practice control. Use plain soap for patient care activities. It removes bacteria but does not kill them. Use antiseptic soap for high-risk settings. The chemical eradicates organisms from the skin. Common FDA-approved antiseptics: chlorhexidine gluconate leaves a residue on skin, giving protection for some time after hand washing. Alcohols reduce bacteria but dry skin. Iodophores are water-soluble complexes of iodine with organic compounds. They have excellent activity but are harsh on skin and stain skin and clothing. An example is betadine. Disinfectants are used on equipment to get rid of pathogenic organisms. An example of a disinfectant is bleach. Bleach is effective and economical. Activities which should be followed by hand washing: after every patient contact, after removing gloves and other protective wear, after handling body or blood fluids, when visibly contaminated with blood or tissues, before leaving patient care area, and periodically during the day when handling body fluids. Work practice controls associated with sharps. Store and dispose of sharps in puncture-resistant, leak-proof, and closable biohazard containers. Locate sharps container close to the area of use, and discard them before the sharps containers are full. When transporting sharps containers, they must be closed prior to removal and locked. If there is a risk of leakage or outside contamination, place primary container into a secondary container, which must be labeled, sealable, impervious to leakage. The following items should be labeled with a biohazard label: specimens, laundry bags, contaminated equipment sent for repair, containers of regulated waste, refrigerators, freezers, phlebotomy trays, containers for storage, transport, shipment of blood products, sharps disposal containers, extracted teeth, and secondary transport containers. Personal protective equipment, PPE, is appropriate only if it does not permit blood or other potentially infectious material to pass through to the work or street clothes, undergarments, skin, eyes, mouth, or other mucous membranes. It is used under normal conditions for the duration of time which the equipment will be used. Gloves, gowns, face shields, masks, eyewear, respiratory devices are all personal protective equipments.